Maureen Connolly, and my guest today on Boxed In is Dr. Jonathan Kanter. He's a professor of clinical psychology at the University of Washington and the director of the Center for Science of Social Connection at UW. Dr. Kanter is also an expert in how to improve relationships and social connections. Later in the program, we'll hear from Jennifer Barr Dean. She's 39 from Columbus. And last year, she lost her mom. And the pandemic has put an end to her weekly family dinners with her dad and her sister and bringing up feelings of loss. But to get started, so Dr. Kanter, recently you've written about the effects of social distancing and loneliness and the importance of staying connected. And in light of the COVID-19 pandemic, you were also quoted as saying that you've never been more concerned for society. So tell me, what are you thinking?
Many people are talking about what a unique and unprecedented time this is. And as somebody who's a clinical psychologist who studies social connection and loneliness and how to help people with relationships, it really is an amazing moment in time. It's like the best of all times and the worst of all times simultaneously. The worst of all times is rather obvious. People are really, really suffering. Some of us are, of course, suffering much more than others, but in general, there's just a tremendous amount of suffering here in the United States and across the world, and the kind of suffering that we're really not used to for many of us. And at the same time, the silver lining, and it's hard to speak of a silver lining right now, given all the suffering, but the best of all times is that people are really yearning for social connection, are really connecting with each other in ways that somebody like me has known to be important to my whole career. And now I'm seeing people doing this naturally, people coping and being really resilient in all these really beautiful ways. And if we could bottle some of this spirit and keep this going even after this crisis is over, I think that would be a real silver lining amidst all the chaos right now.
Yeah, I know. I personally experienced in my own family when I'm describing, with the pandemic pause is a huge exhale, right? So everything got put on hold. And I think we were always just so used to just going all the time. I have a college-age son and two teenagers living with me as well. And so I sort of noticed that we were kind of closer than we've ever been. The relationships have evolved over 6 weeks in a way that I couldn't have ever anticipated. And so maybe you can talk about what's happening, when people, it's hard to live with the same people day in and day out, not really, have anywhere to go. But on the other hand, something's starting to happen in a good way. And so, or at least I hope so for many people.
I think for many people who, even before this crisis hit, people who have experienced like a major life-changing event, a close experience, recovering from a serious illness or an accident, something that really puts people in contact with the meaning of life. Many people have these experiences of suddenly knowing what's important, going back to the basic dance steps. Mm-hmm. And these clarifying experiences. And I think in some ways, this crisis is doing this for us at a much more massive scale, at sort of a social scale. Many of us are just feeling in touch with what really matters right now. What are the important things in my life? The crisis has helped us separate all of that stuff that distracts us on a day-to-day basis and focusing on what's important. And again, I say this with a lot of compassion for people who are really suffering and who are just really distracted by how to pay the bills and how to get food on the table and grief and loss right now. But at the same time, there is this getting back to basics that I think is really important for people.
So if you could talk about what it's like for maybe people who are older or even not older, but people who live alone and kind of the difficulty of sheltering in place by yourself and what those of us can do for each other. Like, how can you help somebody other than, I guess, they're the obvious things like reaching out?
In general, I can say psychological scientists and social scientists like myself, we have a fairly large toolbox filled with evidence-based suggestions for how to cope, how to deal with stress. We've had this toolbox for years, and of course, now it's just a unique opportunity to try to get as many of those tools out of the box as possible. And some of this stuff, I think, is fairly well distributed across the internet. So there are many suggestions, for example, for people to exercise. right now in any ways they can. And it's such an important move for both physical health and mental health. There are many suggestions out there on the internet for trying to just pause during the course of the day and take a few gentle breaths, do something meditative, something that just slows your heartbeat down just a bit, center into your body, connect with your feelings. These sorts of moves are proven study after study to be really important for coping and so forth. Reach out to others and connect with others, people who you maybe haven't spoken with in a long time, or people who you're speaking with all the time, but you'd like to deepen the connection right now. There's just so much research showing that that actually benefits our physical health, our mental health, our well-being, and so forth. Doing things like expressing gratitude to other people. Find somebody in your life who has done something nice for you but hasn't fully been appreciated. Reaching out to that person right now and expressing an appreciation will not only benefit them, but it will benefit your mental health and well-being as well. So there's just lots of tips and suggestions right now, sort of generically, for how to help as many people cope as possible, that I think could really be implemented to positive benefit for lots of people.
Yeah. And so that's a nice segue into the study, the pilot that you're doing, to help people, I guess, learn to engage in better social relationships.
Yeah, well, we started 2 studies. I'm here at the University of Washington in Seattle, and because we were really the first major metropolitan area to get hit by the crisis, we got a head start on the rest of the country. And so we started tracking 500 Seattle residents about a month and a half ago. Just how are they coping every day? How is their anxiety, depression, loneliness, feelings of overwhelm? And so we're already starting to get a sense for people here in Seattle for how they're coping. And by the way, it's not exactly what we're talking about today, but in general, people are actually coping really well.
What are the indicators that they're doing well?
Here in Seattle, we saw sort of a peak in anxiety and feelings of overwhelm and stress relatively early on in the crisis, somewhere in the middle of March. And since then, we're seeing these very gradual slopes downward. People are essentially feeling less anxious, less lonely, less depressed, less overwhelmed over time. And again, I say that with some caution because there are subgroups of people who are really struggling. So we're not seeing that for everybody, but on average across Seattle, people are doing really well. And that actually cuts across socioeconomic status to a decent degree, and it cuts across racial categories as well.
Give us the curve, or I guess the peak, and then in terms of what timeline did you notice this?
Everything is relatively subtle. So the levels of anxiety and overwhelm peaked for most of our participants shortly after our governor issued the first set of statewide school closures and stay-at-home orders. And since then, we've just been seeing a very gradual decline. People are essentially getting used to it for the most part. There's some concern right now about what people are calling quarantine fatigue. I think that's a real phenomenon, but we're not seeing it show up in our data. We're seeing people actually coping pretty well and kind of hunkering down for the long haul and doing the responsible thing pretty well right now. It's really nice to see, actually.
Yeah, I wonder if there'll be different responses depending on the geographic location.
Yeah, well, that's the second thing we did. So we had such a strong response to our Seattle study that we then embarked on a national version of the study. So I can't actually comment on our national data with as much precision because we started that sooner, and I don't know the data quite as well. But we then started tracking how people are doing nationally. We have about 2,000 people in this study. And that study also has a little intervention component. Some of the participants every morning for 2 weeks are getting a tip from our center for how to cope. And so these tips are essentially things I mentioned to you earlier, really brief, simple, concrete things you can do today that hopefully will help you cope better with everything that you're feeling right now. We don't know if these tips are going to help people because we've never tried to send out brief tips like this in the form of text messages to thousands of people all at once. But we do know that the tips come from really solid psychological science. We do know that the tips make sense in terms of what's been effective in the past. And so we're hoping it will help people.
Yeah, that's amazing, right? Is it an open enrollment, or do you already have the people in the trial?
Well, we're still enrolling people. So if people who are listening to this are interested, they certainly could enroll, and we could provide a link for how to do that if they're interested.
Okay. Yeah, and it'd be also too, like to your point about the tips, their feedback on who liked what tip, right? Finding out which tips are the most effective.
Exactly. That's what we're hoping to learn from this, as well as helping people. Yeah.
So I guess, for those who aren't doing as well, what are you seeing in terms of the response?
Well, many of us are very worried about a surge in clinical depression over time, and especially as economic problems start to pile up for people. And they've been piling up for many people already, and they're just going to continue to pile up for more and more people over time. And it's one of the bedrocks of psychological science that when people struggle in this way, they're going to get depressed. At least many of them are. And so, yeah, so we're very concerned about depression and even suicidality coming up. In our data, for example, people who are highest in feeling anxiety and overwhelmed are also showing the highest scores with respect to depression. So people who are more stressed and anxious are, of course, more depressed. People who are um, more lonely right now for whatever reasons are also showing higher scores in depression. And people who are not feeling satisfied in their relationships, who are not feeling relational support, who are having more relational conflict because of the crisis, are also showing much higher scores in depression. So these are some of the groups that we're worried about.
Yeah, so for people who, with I guess partnerships, and being in the situation where that's not typically right how you're living. Say if you're married and you go to work and but now all of a sudden it's compressed time together, day in and day out. Is there kind of some reassurance you can give in terms of like if you're feeling like, oh my gosh, I'm seeing this person how I never saw him or her before. I'm worried, concerned, we're fighting more than ever. And just to kind of say, well, is it bringing up what's really the reality of the relationship, or is it, give yourself some slack and here's what you can do to make sure you don't come out of this and saying, I'm out.
I think I have some advice that is easy to say in a forum like this, but hard to implement. But I do think it's useful to try to share it. And I think this advice applies both to ourselves and to our partners and family members. And the idea is that we are really facing something most of us have never faced before. And our bodies, our human bodies, are actually prepared for this. Over the course of evolution, our bodies are designed to handle incredible amounts of stress and difficulty and suffering. We're actually built for this. We're going to get through this. And most of us are going to get through this, and we're going to recover. So our bodies know how to feel this and know how to respond, but our minds don't necessarily follow along with our bodies. Our minds may tell us, this is overwhelming, this is unacceptable, I can't go on, I can't keep doing this. Our minds may tell us that our partners are behaving in unacceptable ways. And to the extent we can work on just accepting what we're feeling in our bodies as normal, as our bodies doing a normal response to an abnormal situation, and do our best. And again, I know this is easy to say and hard to implement, and do our best to give our partners some slack right now. Give everyone as much rope as possible. Everyone is doing the best they can right now. Again, I know how difficult family conflict can be. I know this advice may seem, oh yeah, sure, easier said than done. But the more we can sort of reorient to that, keep trying that, wake up every morning and try again, do the best we can. Go to sleep that night and say, okay, I didn't do very well today, but I'm going to wake up tomorrow morning and try again the next day. Try again to just accept what I'm feeling, accept what my partners are feeling, and continue to try to support each other in these times.
Yeah, no, I've talked to a lot of people for this series, and I think what you just said was one of the most powerful things I've heard in terms of how to think about this. So thank you for putting it into words, powerful words. So I'd like to bring Jennifer, our guest, on. And Jennifer, she's working from home. Maybe she did that before, but and now her husband's there with her. And she's also has a 4-year-old who she's co-sleeping with, which is causing another layer of stress. And we mentioned earlier too that she lost her mom last year. So thank you for joining us. Do you have a question? I know you've been listening all along, so maybe Dr. Kanter can help you with your situation at the moment. There's, I guess, a number of things you might want to ask about.
Yeah, thank you for having me, and thanks for being here, Dr. Kanter. I think one of the things that you were saying that stuck out to me the most was, using the tools that we have for coping. And in losing my mom just over a year ago, I spent a lot of time in the past year just choosing to slow down and be really present. And I will say, I have found myself in the last few weeks throwing myself into this busy. And so I have to kind of take just a few tools from the toolbox and not all of them at one time. But, is there anything maybe around that specific grief or loss in this time of having another layer of stress and anxiety that I can kind of weed through and maybe focus on?
Well, Jennifer, first, I'm always very humble in these situations, and I just want to say that in many ways, I feel like you and I and Maureen and all of us are in this together. And I can offer you some suggestions, and I do hope they help, but I just want you to know that it's hard,
Mm-hmm.
and I'm not immune to it either. My mother died actually several years ago, and my gosh, that was the hardest experience of my life. And I don't know if I coped very well at the time, quite honestly, but I'm still here. And I'm cooped up with my family and my daughter right now, and we have more conflict than I wish we did, and we try to do the best we can. So I think it's really important that we all recognize we're all in this together. And even though I'm the one who's the expert today, and I do feel I can try to help, that there's sort of an acceptance that we all have to do. And so I want to join you. I want to join you in the difficulty, and not act as if I've got all the answers and I've got it all under control here. For me, I can say the most important thing is to try to go back to the basics. And I really mean basics. So if I can wake up in the morning and try to remember to take a couple of gentle breaths and center in myself, and in particular, ask myself the question, what's the best version of myself I want to be today? What are my values? Who do I really want to be? Like, what's the Jennifer that's the best version of Jennifer today? Try to call that up so it's present in your mind. I don't know if you have an answer to that right now, or if that's too personal to do in this public forum, but I'm curious how you respond to that. Like, what are the values that really guide you through the day?
Yeah, I think something you said that stood out too was, I've spent a lot of time when you have, personal tragedy or a life-changing event. I've spent a lot of time in that space over the course of the past year. And so I know for me, that made me kind of slow down and take that deep breath.
Yeah.
But, I go into the busy and kind of finding the distractions and letting the distractions pick up. And so, again, trying to use some of those tools. I have a 5-minute meditation I listen to every day that I'm like, okay, if I only have 5 minutes, that'll kind of pull me back into that space.
Right.
So,
And
yeah.
I guess one additional suggestion I would have is, as you're trying to get centered and do that brief meditation, again, is to try to conjure up something about your values and who you want to be. So for example, you're a mother, you're co-sleeping with your child right now. So I'm guessing that being a good mother is really important to you.
Yeah.
Being a good partner is really important to you. And there are some details in there about what that looks like for you. And I would want you to try to remember at least a couple times a day to take a couple breaths and center into not just your body and your breath, but those values. Who do I want to be? And the second piece is, with that connection to the values, then recognizing that all of the stress, all of the feelings, all of the negative thoughts that get in the way and distract us, all of the urges to avoid, you actually don't have to make all that go away to be who you want to be. It's one metaphor we use is this idea of having passengers on a bus. And so if you're willing to go with me for 1 second, the idea is that you're the bus driver of your life, and you get to drive the bus wherever you want to go, towards whatever values are your values. And all of that stress, all of those feelings, all of that anxiety, all of those self-critical thoughts, all of those doubts, all of that avoidance, all of that negative stuff, those are passengers on your bus. And they can be yelling at you as loud as they want, but you still can drive the bus where you want to go. It's a little bit of a different idea than I have to get rid of all this stuff in order to be who I want to be. And so that's sort of what I'm throwing at you, this idea right now. How does that land on
I
you?
like that. It made me think of the screaming almost 4-year-old in the back of the car when I still have to get somewhere. But
that's perfect. Yeah.
So I gotta take it with me.
Yeah, so you know that you can keep driving towards your destination even when your 4-year-old is screaming at you. And you can sort of take that idea and make it like a mental thing about the ways you end up sort of screaming at yourself or so forth.
Yeah.
So the idea is to, and again, in a very humble way, I throw this metaphor at you and I hope it's helpful. And I throw this idea of values and breathing at you and I hope it's helpful. But for me, I can have just moments of clarity over the course of my day when I can be this way, and then I lose it, and then I'm just distracted and I'm avoidant and I'm doing all the stuff people do also.
Yeah.
And so the goal is to just look for moments in which you can be this way and try to maximize those moments or increase the frequency of those moments, but have a lot of compassion for how difficult it is right now.
Yeah. Compassion is for sure.
So Dr. Kanter, I want to bring this back around to social connections, because obviously so much of your research focuses on that, the importance of that. And, I've been thinking about, I guess pre-COVID, right? And how dependent we all were and continue to be on our phones and video calls and so forth. And so in many ways, and this has been, talked about, that people use that as a buffer, right? It's like your head's in the Instagram or Facebook, but what about the face-to-face time? And now here we are, and I feel like people are craving that, obviously, the real time, the human connection. And then when we reemerge from this pandemic, at some point we're allowed to go out and play with our friends again. What do you hope people remember, and what, I guess, about how important it is for human connection, right? Like, what do you hope they'll take away? Because we forget things so quickly often, and go back to our bad habits. So
I think one of the wonderful things for me during this crisis, and every time I say wonderful, I have to throw in the caveat about how horrible it is also, is that I have seen this yearning for connection, something that I've been preaching my whole career. And now I'm seeing so many people reaching for it naturally and doing all these wonderful, creative, inventive, and at times beautiful things to connect with each other. And if we can bottle that and keep that going afterwards, I know personally and as a scientist the tremendous physical and mental health benefits of when we feel connected to each other. So to the extent that we can do that now and keep that going, I think that could be a real lesson learned from all of this. And I think for many of us, that's happening very naturally, and all I have to do is sit back and observe and appreciate the beauty. But then again, some people are really struggling and they're yearning for connection, but they're also exhausted and stressed and avoidant and tired and just closing in on themselves. And for those people, again, recognizing that life is really hard, if these simple ideas of just breathing, trying to connect with who you really want to be, trying to connect with what's important about relationships and why you want to have them, and then taking all of that avoidance, all of those self-critical thoughts, oh, this person probably doesn't want to speak to me anymore, or maybe the last time we talked we had an argument, so maybe they're still upset with me. All of those self-critical thoughts, those are essentially the passengers on your bus that you can take along with you. I can say for myself, I contacted an old friend. I was the best man in his wedding many, many years ago, and we hadn't spoken in about a decade. And I was very nervous to call him. All of those self-critical thoughts showed up for me. But my 15-year-old daughter convinced me to call him, and I thank her so much for doing it, because it was just the most wonderful connection. And having him back in my life felt like literally very soothing in a palpable way. And I couldn't have done that if those thoughts sort of pushed me around. So I think it's really important for all of us.
And I have a question about the physiological benefit we get from being in front of a person. Like we're out in the world day in and day out, you get your coffee, if you go to an office, right, or whatever you do, volunteer, and that we're really we're not getting that right now. And Zoom certainly is wonderful, but I'll be the first to say, like, there's something missing here, right? So what is that?
Yeah. I think there was this article written recently called "Why Zoom is Terrible," and the author pointed out some of the ways in which the digitizing of our faces and our voices disrupts all of the natural nuances that are so important to connection. And I think as we've been living in a video chat or Zoom world for some of us over a month or two now, we're starting to crave what's missing. The being in the warm presence of another body, being able to have really good eye contact, having our faces and brains and mirror neurons just naturally sync up with each other, such that as soon as you make a little subtle facial expression, I make it as well. All of that natural stuff is disrupted right now, and we're all starting to yearn for and crave it. But that said, I disagree with that article that Zoom is terrible, because seeing each other, the closer to live interaction we get, the better. And seeing each other is so important. I don't think that idea that Zoom is terrible could have been written a month and a half ago. I think that's a function of the fact that we're now starting to really notice what's missing from Zoom. And so thinking about how we can supplement that, sometimes a phone call where we can really hear exquisitely the breath of the other person and the fine-tuned, subtle nuances of our vocal expressions can be really helpful. But seeing each other is really important too.
Yeah, my mom turned 81 a couple weeks ago, and I drove down with the kids, and she sat in a chair in her garage, and I sat at the end of the driveway. And 15 minutes, left her some flowers, but it's a memory that I have I'll never forget.
Yeah.
So, Jennifer, with your dad and sister, have you been able to replicate any type of? Are you having dinners on Zoom, or how's that working out?
We've done some social distancing dinners and stayed outside. We just, we decided we were, quarantining, is that the term, that way, and just, mindful of our space and what we're touching, and, being as safe as we can, but trying to find some normalcy in some of it, and having that community and, communion, whether it's around a table or we're spread out a little bit. But I'm absolutely hearing what you're saying. I'm a hugger. I meet someone for the first time and I'm a hugger. So I love that I've been able to connect with people this way. And we've done a lot of FaceTime, and, my sister has 4 kids, so the cousins want to see each other. But I think maybe only twice in 6-8 weeks, where it's normally every weekend. So it's definitely been a challenge. But trying to make the most of it, and like you said, creating new memories, I guess.
Yeah.
I think you should really trust your instincts. It sounds like you're doing the really important things. And I encourage you to not only trust your instincts, but allow yourself the freedom to be as creative as possible in how to do these connections, and keep trying different things. Your instincts are really good. And your observation that you're a hugger and how much you miss and crave physical touch, again, acceptance around that is so important. That is probably one of the main things we're missing, just the soothing, the burst of oxytocin that comes from when we're able to give each other some sort of comforting hug or touch. It's really difficult right now. And so just sort of opening up to that in our bodies and telling us it's not going to be forever, that we will get this back, I think is really important.
And so to kind of wrap this up, the last question I have is around children. And I know we could probably talk about that for an hour, but in terms of, school age kids and what they're missing out on social interactions, right? So yes, mom and dad are there, or mom and mom, or dad and dad taking care of them, but like what can we do as parents to make sure that they're not socially, impacted on a big level by this?
Well, children are going to be socially impacted in a big way by this. I think that's just unfortunately the reality. But children in particular, their brains are so plastic and flexible, and they're going to be impacted potentially really hard right now, but they're going to recover quicker than the rest of us as well. They're going to snap back to normal, most of them, once this social distancing goes away, and they're gonna, most of them are gonna really be okay. But again, anything we can do, creative things to support our kids connecting with each other right now is super important. My daughter had the brilliant idea to not just throw a online dinner party with her friend's family such that we all ate together, but her friend and she actually cooked dinner together as well. They picked a recipe together. They put Zoom up, some video chat up for several hours together in their kitchens, and they cooked the same recipes together. And so then when we sat down to dinner, we were actually eating the same food and commenting on the recipes together as well. And that was just a little creative idea of my daughter's. And I just think those sorts of ideas right now, to the extent you have the resources and can implement them, I think can really go a long way to making this time go as quickly as possible right now.
I love that. We launched COVID Tippy. Tippy is our tool on everyday health that people can, navigate through and get hundreds and hundreds of tips from real people and also professionals like yourself around how to cope with this pandemic. So I'm going to add that tip to Tippy about the dinner party, because I think that's fabulous. And I want to thank you both for being here. This has been so wonderful. And I wish you both well in this, because as you said, Dr. Kanter, we're all in this together. For more great tips on navigating your health and well-being during the COVID-19 pandemic, go to everydayhealth.com/Tippy.